I had this conversation with myself where I wasn't happy with the results I was getting for people. I felt like there was something more. When I started watching Dr. Chris and some of the other practitioners getting these great results and talking about it, there was I had a moral and ethical dilemma, and I just didn't feel right having this exchange and not feel like I was making a permanent relief for someone. Within the past month, we've gone from seeing about roughly 70 people a week, and it jumped right up to 90 to 100. And that was, I know from implementing these things, because we were getting immediate referrals. Dr. Todd from Massachusetts. I've been doing the adhesion stuff for probably 7 years, really getting into the training in this past year. I had this conversation with myself where I wasn't happy with the results I was getting for people. I felt like there was something more. When I started watching Dr. Chris and some of the other practitioners getting these great results and talking about it, there was I had a moral and ethical dilemma, and I just didn't feel right having this exchange and not feel like I was making a permanent relief for someone. Before, when we were just adjusting, I felt like it was a 2-3 week time before people started noticing a bigger change. When you understand that most acute injuries fix themselves on their own, that's the question and moral dilemma I started to have, was all right, well, are they just improving because of time, or is this adjustment and stuff I was doing actually helping? That really was the biggest problem the first couple of years. I was frustrated. I actually, three years into practice, had gotten into a deep, dark depression, and I know a part of it was because I wasn't feeling fulfilled. I didn't feel like I was doing what I was really meant to do with these people. The adjustment and the way we were running practice was just not something that I looked forward to every day. It wasn't lighting me up, and so something needed to change, and that was a big deal for me. And since then, and since making this change, I'm far away from the depression and feeling like I'm not providing for the people. I knew him from school. I knew that he was into, at the time, integrative diagnosis, which is what led me to the online stuff. And 7 years ago, I was interested in it. I didn't see the path like Chris saw at the time. Watching his success through what he's been able to do is what drew me down to coming more frequently to the hands-on trainings. He holds a special place in my heart. He's somebody who, when I was at my lowest, he reached out. He was the only one that really reached out to me and opened up his heart, opened up his home, and said, there are other ways that we can go about dealing with this and working through this. And he understood it because he had been through it. To be able to run a practice and teach people how to be great at what they do so they can run similar practices, he just has so much capacity. And you see it when you're here, you see it when you're with him. I can't speak enough of him. So being around other people that want this type of success for their patients. I don't think I run into any other chiropractor. I'll just leave it at chiropractor for now, that truly wants this for their patient. There's so many other things that they put ahead of the results. When I get into a room with other chiros, it's not about I got this person these awesome results. It's how many visits, and I'm sick of my notes, and just all these other things. But when I'm down here, we're talking about these phenomenal results that we're getting, and I think that's the reason why we all signed up. Yes, to have a great business and all that, but that's the biggest thing. The second was implementing. There are steps, and you're taught to do these steps. And when you don't do those steps, you feel lost. You don't feel like this is working to the extent that it can. And the one thing that I did that made the biggest change was actually in the past month. I was feeling the same way. Even leading up to it, I was getting great results, but there was steps I was skipping. And so what I did is I went back and I implemented a lot more of the steps, the paperwork, the pre and post test, all of those. And then being able to convey that and communicate that to patients. Within the past month, we've gone from seeing about roughly 70 people a week, and it jumped right up to 90 to 100. And that was, I know from implementing these things, because we were getting immediate referrals. The biggest change has been even just in the past month. I know that we've been impacted financially. I can't say I have specific numbers, but leading up to the change of implementing the documents and the tests and all the steps, Just in this past month, it's grown exponentially, because if you think about an extra 20 visits a week, you think about more referrals, so more new exams, all of those things. Just in the past month, I've seen the growth. And as I shared with Dr. Chris, when we come to the seminars, he's always asking us what our goals are. And up until this time, I couldn't see what my goals were. Nothing seemed tangible to me to be able to reach, because I wasn't creating the systems and doing the systems. And now implementing that, I see where our growth can go with our practice. So the growth financially has been recent, although over the years, I know that we've been getting referrals and we've been getting more people in because of what we do and how it's different. But the last month since I decided to make that change is when we've seen an exponential growth.
If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with Adhesion Release Methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.